Hello and welcome to the IntensiveCareHotline.com podcast. IntensiveCareHotline.com helps families of critically ill patients in intensive care to instantly improve their lives so that they have peace of mind, more control, more power, and more influence, and so that they can make informed decisions. I'm your host, Patrick Hutzel, founder and editor of IntensiveCareHotline.com, and as part of our podcast and interview series today, I've got a very special guest with me. Welcome, Jenny. Hi, Jenny. How are you?
Hi, how are you?
Very well, thank you. Jenny, thank you so much for coming on to this podcast. Jenny, you and I have started working together mid last year. You've come to us when you had your mother in intensive care. When I found out about what was happening in intensive care, I was very shocked, even though I've worked in intensive care for over 20 years and I've consulted hundreds of people here in my consulting service. Your mum's situation was unprecedented, and I was really shocked to see what was happening at the time. But I don't want to keep our listeners too long because I really want you to share the story, what happened with your mother at the time.
Yeah, my mother was 76. Actually, she had just turned 76. And she was at one hospital that had put her on a trach, an event. It turned out she didn't need a vent. And I had sent her there to long-term rehab. And the long-term rehab sent her to, I was her POA. The long-term rehab sent her to a hospital without my consent. And she was a dialysis patient 3 times a week. She was not given any dialysis. She was not fed. And I was basically, they forbid me from seeing her. And when I reached the hospital, she was also not really conscious. She was like a vegetable. I wasn't given an explanation why she had come to the hospital or why she wasn't responsive. She was also given fentanyl. She had taken painkillers before, but never fentanyl. And when I finally could see my mother, I had discovered that for 3 weeks they had not been feeding her. And also they said that she had a CVA, but the cause of death turned out to be different than what they said. And she died on September 6th, 2019.
Yeah. And the circumstances at the time were very dramatic, in terms of, I from what I remember, you got locked out of the hospital. You couldn't even spend time with your mom in her last few days.
They actually locked her out of all visitors. They didn't let her have any visitors.
And how did you feel about that?
Well, they claimed that she said she didn't want visitors, but when I first saw her, she wasn't even conscious, so I don't even think that's a decision she could have made. And she would never make that type of decision.
Yeah. And can you share with our listeners what led to the quote-unquote lockout, and what led to this, and potentially how other families can prevent that from happening?
Well, what led to it, I think, is that I had showed up at the hospital and I was demanding care for my mother. She had left from the hospital. She did dialysis Monday, Wednesday, Friday, and I was told that the rehab would give her dialysis, and they didn't. And she went without dialysis for almost a week. And it was when I demanded that they give her dialysis, they didn't even have her on the dialysis schedule. I obviously got upset. I demanded a nephrologist, and that's what pretty much led to the lockout. They didn't want me to see my mother. They said first a 24-hour ban, and then they just kept making excuses to not let me see my mom. So at that point, I had no idea what was going on.
Yeah. And from what I remember as well, Bonnie, there was definitely some misdiagnosis because, as you said, they were saying that your mother had a stroke, but that was never confirmed. The other thing that I remember is in the last days of your mum, it turned out she had a gastrointestinal bleed. Do you remember that?
Yeah.
She had a massive
They claimed
gastrointestinal.
Yeah.
They claim she hasn't had any nutrition for 2 weeks, as you said, and she was never offered TPN, transparental nutrition. So she was never.
And you remember you were on the you were in the meeting where you asked them about TPN, through on the phone,
exactly.
and they wouldn't give her the TPN.
That's right. So you could claim that, she really was starved to death. I mean, that's almost unheard of that somebody hasn't had nutrition.
I don't want to get too graphic, but I don't want to be too graphic, but if I describe the remaining days of her life, the day before she died, when they finally let me see my mom under very tight restrictions, and I had not been violent, I didn't have a weapon, I was just advocating for my mom. Her neck was bleeding, and her eyes were rolled back into her head, and before in the rehab she was saturating at like 100. Her ventilator was set to 44 and she was literally gasping for air, and they weren't feeding her. And I don't want to get too graphic, but she basically looked like a Holocaust victim. She had no nutrition at all. And I have the image you saw. So.
Right. And the other thing that I have in my notes here from that time, Bonnie, is she had a DNR that you or your mom never consented to.
No, I never consented to the DNR.
Which is again illegal. A hospital has to have consent either from a patient or from a medical power of attorney before they can issue.
And I was deemed her POA. I was her proxy, her power of attorney. And the doctor came in and she said, I put a DNR, for medical futility. And when I argued with her, I was escorted again out of the hospital.
Yeah.
So I had never.
You were never given the option to challenge anything that you could have challenged under normal circumstances if you had been part of her, of a normal hospital interaction, which is you can visit your loved one. That's a normal hospital interaction.
Well, here's the thing. I didn't have any part between the rehab sending her to the hospital and her time in the hospital. I was not briefed about her condition. I was not allowed to make any decisions. I couldn't see her. I did not know her diagnosis. I mean, when I arrived at the hospital, she was like lying on a metal table, like almost like her eyes were staring out into space, like she was brain dead.
Right. And I remember also you weren't allowed to have access to the medical records, which again is illegal, because under the Freedom of Information Act, in any country and in any state around the world, you have the right to have access to the medical records.
No, they finally did. They finally gave me the access to the medical records, where I found out that they were trying to get guardianship of her. But I only found it out, they wouldn't initially give me the medical records. They gave me half of them, and then they finally sent me the rest of them, and which all had the remainder of the medical records had a lot of inaccuracies. So.
But at that crucial time, I remember that at the crucial time of when you were wondering why is she in ICU and you were told she had a stroke, but that turned out not to be the case. No. You, as far as I remember, you didn't have access to the medical records.
No, I didn't have access to the medical records at that time. No.
At that time,
I had no idea what was going on. I wasn't told. I had no idea why. Basically, from the rehab to the hospital, that initial time, that crucial time, I had no idea what was going on with my mother. I had no idea. The hospital didn't even call me that my mother was there.
Yeah, I remember that. And as I said, from when we started working together, then it was an absolutely traumatic time for you. As I said, it was unprecedented for me also that the hospital can be so cruel and lock a daughter out of the ICU to see their mother. who was dying at the time. That is almost unheard of. Whilst in retrospect, also trying to take your guardianship away from her, whilst you were trying to advocate for her.
Yes.
That's unheard of. What would be sort of would be your message today? Number one, to other families, but also to the hospital. Maybe, you know, what would be your message with this traumatic experience in mind?
Like we had once discussed that the hospitals are there to treat and they're not there to decide, you know, what quality of life is worth treating and saving. That the minute that someone comes into the hospital, like you said, they have the right to, you know, they have a duty of, you know, to care for the patient.
Duty of care.
And it's, you know, do they have a duty of care? And they also have to keep in mind that these are people's families, they're people's loved ones. Like, this is my mother, you know, like, to them, they don't know who she is. But, you know, no matter what shape she was in, and she was very sick. She was very sick. And she had, you know, she had a lot of comorbidities, but she was still my mother. They're still people. There's someone's family member. There's someone's loved one. And the loved one should be able to keep in contact and know what's going on so they can make the right decisions for their loved one and the decisions that they want to make. And also follow the decisions of, you know, what their loved one told them, like if they made them the proxy.
Yeah, very much so. And in this situation, it was, as I said, unheard of, somebody being locked out. It had to feel to me at the time you were locked out, so that your mother was, that it was easier for the hospital to deny your mother treatment, so that nobody could challenge them basically killing your mother. That's what it sounds horrible for somebody listening to this. They might think we're making this up. Well, I can assure you,
that's what they
we're
think.
not making
and you know what else? I remember when I had spoken to you, and at one point they would only allow me to call, and they would only give me one update per shift, and you had given me a list of clinical questions to ask them, and they had obviously been making all of that up, which is crazy, because you gave me all those questions to ask, and I would call, and they said you're only allowed to call, you know, once per shift for your mother. And the reason I called a lot is because they wouldn't let me see her.
Yeah. And as I said, there were so many, what's the right word? It was just an awful situation, and you were denied, literally, you were denied, and your mum was denied basic human rights.
Yes.
In a first world country, you were denied basic human rights. Your mother was denied basic human rights.
Yes.
She was denied health care to save her life. And, you know, if I hadn't seen it with my own eyes, if I hadn't heard it, I would say, you know, the hospital really killed or even murdered your mother.
Yes. But it's hard for people to believe because, you know, we want to think of these hospitals as healing places, and a lot of times they are. But I spent every day of 3 weeks. I mean, I tried to also, I was denied my wishes that I wanted to transfer. Like, I was trying to transfer my mother out, and I was speaking to transfer centers, and they would like tell me that the transfer center denied my mother when they never did.
Right. Yeah. So it was really an unprecedented situation where your and your mother's vision had been ignored. You know, starting from you being locked out, going all the way to, you know, denying dialysis. Basically, the DNR was imposed. It turned out in the end that there was no official, or the diagnosis wasn't really communicated to you properly, because in the end it turned out it was something entirely different.
Yes, because I had to have my own private autopsy.
And it turned out that after you had the autopsy results, that what the hospital was telling you while your mother was in ICU was something completely different compared to the autopsy result.
Yeah.
So again, it made you wonder, made us wonder, what did the hospital have to hide?
Yeah.
While your
And
mother
what was
was
their
not
motivation? What was their motivation to do something like that?
That's right. And one thing that I always say is, and people, unless they work with us on a one-to-one level, they often don't believe me. But the reality is ICUs are overcrowded. ICUs don't have enough beds. They don't have enough staff. One way to unfortunately manage beds is to deny some patients treatment and let them die. And I believe with the situation that we were encountering at the time, I do believe that is exactly what happened. Your mother was denied treatment. You were denied access so that the hospital could basically run their agenda.
Yeah.
Your
I was in
agenda
the way.
was to have your mother treated. But
Yeah.
it turned out the hospital had to have their own way to manage their agenda.
Yeah.
And that cost a life.
Yes, and also the other hospital, it turned out that my mother died of a septic embolism, of encephalitis, and there was a bacteria that went to her brain, and were not giving her antibiotics. So I think it started in the other hospital because they weren't giving her the appropriate course of antibiotics that she needed.
Mm-hmm. Right. And do you remember in the other hospital, was there a DNR in place as well?
No, but they had, in the other hospital, they had tried to do an amputation, and they had also said that, she probably wouldn't make it.
Which is what hospitals say always. And I have to put that in here for our listeners. You always hear the doom and gloom from hospitals.
No, they'll say she has multiple, they say her age, her multiple conditions, things like that. And
sure.
And it's just I think I want other families to know that you always have to question that if you can't just leave your loved one in a hospital and think that they're being taken care of and everything is okay. You have to check on your loved one. You have to talk to the doctor. You can't just take everything the doctor says to heart. You have a responsibility too to your loved one.
Definitely.
Once they enter the
and
hospital.
That's what I always say. The biggest challenge for families in intensive care is that they don't know what they don't know, and they often don't even know what questions to ask. And once you know what questions to ask, and once you know what to look for, the dynamics change, because then the ICU knows, oh, you're actually talking to someone that understands intensive care, and that is really important.
In the first hospital, they had actually, they didn't amputate her leg. I mean, I was asking questions, but when she reached the final hospital, they were locking me out. So at that point, they wanted to prevent me from knowing anything. And as you said, I couldn't make the decision whether to decide whether her life, I couldn't, I really didn't, I was powerless because I didn't know what was going on. I was left in the dark about her diagnosis, about why she was taken to the hospital, about her prognosis. I literally couldn't make any decision.
Yeah. And even worse, and I think that's where the human aspect is really coming in. You weren't being at your mother's bedside in her last few days. I mean, that must have been absolutely devastating.
They would give me certain times where I could come, and when I called them, they said, "Where are you?" They said, "Your mother just passed." They didn't even call me that my mother passed. I called that.
Appalling. Absolutely appalling. Normally, ICUs have an inclination to know, if somebody is approaching the end of life. And, most ICU that I worked in, at least, you would give medical power of attorney or a relative a courtesy call and ask them to come in if they wanted to spend time with their loved one.
Well, the thing is, I'm really her only daughter, so by default, even though I had the papers, I'm her only daughter, so I had a right to know what was going on with my mother.
For sure. Mm-hmm.
So I would urge families to just, when their loved one is in the ICU or in the hospital, to really not just think that they're just getting care and just leave. You really have to be proactive, and you really have to be your own loved one's advocate when they're in the hospital. Because if you don't do it, nobody is.
Nobody is. Yeah,
No.
for sure. Despite, hospitals always claim, and ICUs always claim, that they know what's quote unquote in the best interest for a patient, but death can't be in the best interest of a patient as long as not everything has been tried. And in your mother's situation, not everything had been tried. She was denied dialysis, she was denied nutrition. If that had been given a shot, if she had that treatment and it wouldn't have succeeded, different story. But she didn't even have the opportunity to have that treatment in the first place.
No, she was denied care.
She was denied care and treatment.
Mm-hmm. Yeah.
Life-sustaining treatment.
Yes.
And you were denied information, and you were denied to be at your mother's bedside.
Yes.
And
I could not be at my mother's bedside when she passed.
Yeah. And why would an intensive care unit withhold medical information? They only usually do that if they have things to hide.
Yeah.
It is a duty of them to be open and transparent, which wasn't the case in your mother's situation, which is a big red flag if ICUs aren't transparent.
And also, they said that she had this big gastric bleed, but the autopsy didn't say that she had a perforation, and they could have given her TPN. They just denied. They didn't give her anything.
Yeah. So you could almost argue your mother was part of it. Was she was starved to death. That was part of it. I mean, if somebody is critically ill, they have low energy. If they're not getting nutrition, it's only getting worse.
Yeah.
And this is what's happened in your mother's situation.
But I'm glad that she was not conscious, because she loved to eat. So, I mean, that at least,
right.
She wasn't aware she was being starved to death. But I couldn't even believe it, because I knew that even if they were bad and I wasn't there, I was expecting that they were giving her the basics. You know what I'm saying? Like, you would think that they were feeding her at least, like they were giving her nutrition, because that would be like one of the basic things that a hospital would give.
Look, I mean, withholding food really is cruel. I mean, that's denying. Again, it comes back to denying people basic human right.
Yeah.
Bonnie, we were briefly talking about this before this interview. At the time of this recording, it's March 2020. The world is in a significant health crisis with the coronavirus.
Yes.
Bonnie, what do you think might be happening with the coronavirus and patients in ICU? And we have already seen some of it. I'm playing devil's advocate here, but we have already seen some of it in Italy now and in Spain. But what do you think might happen where you are and where I am if the coronavirus spreads even further?
Well, the hospitals are working on limited resources, and they have to kind of pick and choose who they give those resources to. And unfortunately, even in Italy, I think they stopped giving ventilators to people over 60. And I think that's going to hit the US eventually. I think the ICUs are very overwhelmed with patients because of how fast this coronavirus is spreading. And I'm very concerned about the elderly population, because the hospitals simply, they do not have the resources. They were not prepared. And maybe they don't have enough ventilators, and they have to kind of choose. So I fear that the US could be like Italy in that way.
Yeah. Look, again, I've been saying this for many years, that ICUs are already choosing, not as overtly as they do in Italy now. I mean, it has gone public that, the doctors are choosing in Italy. I believe, from my experience, it's been happening, for many, many years. ICUs have to manage limited resources. They just don't do it as overtly as they do now in Italy. But ICUs are constantly making decisions of who's going to live and who's going to die. Now,
now we just see it. We're seeing it more, but since this virus.
Exactly. That's exactly right. And this is, if this pandemic situation gets out of hand, like it did in Italy or in Spain or in China, we will see the same where you are, and we will see the same here where I am, that when ICUs get overflown, that doctors have to make very tough decisions, and they're not good decisions to be made, but that's potentially the way it's heading. And if you as a family member don't ask the right questions, you can't advocate for your loved one. You really need to understand intensive care inside out to understand what the decisions are based on. So we might.
It's about the resources, scarcity. They only have, there's only so much they have. There's only so much the hospital gives them too, So, I mean, it's a very scary situation, especially for the elderly population and the immunocompromised and the sick, because they have to make very tough decisions.
Very tough decisions. Yeah. As I said, and I've said it for many years, this is already happening. And now with the health crisis, already happening, this is only going to be exacerbated. My other concern is everybody's talking about buying more ventilators, and that could be one solution to the problem. But the reality is somebody needs to operate those ventilators, and that takes often many years of theoretical and practical training. You don't become an intensive care doctor or an intensive care nurse overnight. So yes, it's good to buy ventilators, but if you don't have the skilled staff that can operate those ventilators, it's almost like a futile exercise. You can't just train somebody to operate a ventilator overnight. It's not a 2-hour course. Yeah. It takes years of training. So that is another one of my concerns, that, who's going to operate and look after all these ventilated patients potentially?
It's a very scary situation.
Very scary situation. And as we can already see in Italy, patients are dying by the minute already.
Mm-hmm.
And we can only hope that
is coming. The U.S. is going to be next. The U.S. is heading towards that example.
Mm-hmm. Yeah, where people are almost dying by the minute.
Mm-hmm.
It's not it's a very bleak outlook. It's a very bleak outlook.
These hospitals forget. They, I feel like the hospitals see people as numbers. And also, like with my mother, I was very, very close with her. I mean, we were all each other had. And the hospitals are not really seeing these people as humans. They're just seeing, their numbers, their money, their dollar signs. And it's a really sad and scary situation where they're essentially deeming whose life is worth it and whose is not. You know what I'm saying? Like, so.
Yeah. It's scary times, and if families are not prepared for, and here is another thing that's happening, Bonnie, at the moment. Because of the coronavirus, I have been talking to clients in the last few days. They have loved ones in ICU. Now they don't have the coronavirus. However, they are locked out of the ICU because of the coronavirus. Hospitals are locking families out because they're scared that families bring in the coronavirus. So they're using it almost as an excuse to lock people out, which is what's happened to you, which is another scary part of this situation.
Like someone posted, I saw that there was someone older and they were in the hospital here and they didn't know where they were and they hadn't heard anything about, where their family member was. So
right. It's scary times, and I believe it's the same in Italy from what I hear, that families are locked out of ICUs because of the virus, and that loved ones are dying without families being present.
Yeah.
It's very,
with
very
my mother,
scary.
I wasn't able to be present. I wasn't able to be there with her. And the whole time it was going on, I mean, I'm still very traumatized by it, but of course I wasn't even ready to discuss it for so long, you know. You remember, it was very, very hard for me. So
Mm. Yep. But I'm really grateful that you are taking the time to talk to us about it, because I think, you know, people need to know that it's happening. It is, up until last year, I had not come across that people are locked out. You know, hopefully up to this point, it was an isolated case. It's still a very poor example from a hospital point of view. But now, especially now, again, with the coronavirus, it seems to be more commonplace that people get locked out. And given that people die in droves, literally, with the coronavirus, if families are not around, it's even easier for hospitals to, you know,
exactly,
not
and
give.
that's why I want to tell families that, you know, even in a nursing home, a hospital, doesn't matter. If you think that you're just having your loved one there and they're going to get this great care and you don't have to worry, that's not true. I mean, you have to be as integral in their care as the hospital or the place is, you know. You have to be involved.
Yeah, which
You
is
have
what
to
I always say.
essentially be your own advocate.
Definitely, you have to be involved. You have to advocate, because again, ICUs don't always do what's in the best interest of a patient or a family for a number of reasons. And I have written about this extensively, what those reasons are. They include financial, they include staff resources, they include bed management, and they also include things like, you know, some doctors and nurses as well, they do believe they are they do believe that they are the only ones who know what's best for a patient, and that's simply not wrong. And that's the issue with them seeing patients as numbers and not as human beings with a life, with
No.
interests, with families.
No. And when the family member is not around,
Bonnie, you're dropping out. You're
they have
dropping out,
no,
Bonnie.
sorry. When the family member's not around, they don't even have any doubts, so they don't have any worries about doing it.
Yeah, yeah. Bonnie, we're coming to sort of to the 30-minute mark here, and I know in sort of in be conscious of the time. You know, hopefully we can continue this conversation in another interview.
Yes.
But thank you for sharing what's been a very traumatic and difficult time for you. Really appreciate that were willing to share with our listeners what you've been through, and you know, so that other families don't have to go through the same. It's been very traumatic experience. So again, can't thank you enough to come on and share this.
But I think it's also, I think it's also important. My story is also important because it's relevant. So to go through
Yes,
something traumatic and, you know, hopefully other families can avoid this, or they can know what's going on in these ICUs. They can know, they know that they have to keep track of their loved one. They have to keep on top of it, especially through such a crisis. The
yeah,
hospitals are overwhelmed. If you don't keep track of your loved one, the hospital is not going to do it for you. So
no,
it's important
no,
to know that.
yeah, yeah, and your experience with being locked out might now again unfortunately become commonplace, because hospitals would be worried that people bring in the coronavirus from the street. Or on the other hand, if they do have patients in ICU that have the coronavirus, they might say, well, we got to keep you out of ICU
Well, they
because
might
you
say,
might get
we have to keep you out because you might have it and you might
yeah,
spread it more. So that's even more of a reason
yeah,
for them to keep families out, and they're in
yeah,
the dark about what's going on.
yeah, yeah. Very, very challenging times. Um, you know, if you need help with any of this, as our listeners, you know, you can always contact us at intensivecarehotline.com. Bonnie, I really want to thank you once again, and hopefully we can continue the conversation in another interview, because I know you've got lots of wisdom to share there, unfortunately, that our listeners will benefit from. So thanks again for coming on to this
you're
interview.
welcome.
Okay, thank you. Thank you. We'll talk soon. Now, if you have a loved one in intensive care, check out intensivecarehotline.com. Give us a call on one of the numbers on the top of the website if you need help, or send us an email to support@intensivecarehotline.com. Thanks again for listening to this podcast, and I'll talk to you soon. Thank you.